Okay, colleagues, let's start our meeting.
Bien, chers collègues, reprenons notre réunion. Je sais que nous avons déjà eu une réunion longue et intense ce matin, mais voilà un autre panel très intéressant pour cet après-midi.
I will do the announcements.
Alors, je vais faire maintenant nos annonces et ensuite nous passerons au point suivant. Tout d'abord, quelques annonces pour les collègues députés. Tout d'abord, pour le rapport d'initiative, il y a de bonnes nouvelles. Le 30 juin, la conférence des présidents a adopté notre demande d'élaborer un rapport d'initiative sur les leçons à tirer pour la crise de Covid-19. Donc nous avons le feu vert pour lancer nos travaux. Ensuite, il y a eu une décision également sur nos travaux. Les coordinateurs se sont mis d'accord sur 3 propositions de séminaires. Premièrement, prévention de la pandémie. 2, séminaire sur la résilience. 2e, préparation et réponse. 3e, sur le Covid long. Il y aura un séminaire à ce sujet. Ensuite, nous avons nommé des membres et des substituts pour le réseau de coordination. Cela passera par une procédure écrite. Monsieur Grimporopoulos du PPE et Madame Djerkovic pour le groupe SED. Et en guise de suppléant, Madame D'Amato du groupe Vert. Mission en Italie. Le programme de la mission en Italie est en train d'être finalisé. Les groupes politiques sont invités à envoyer leurs toutes dernières remarques. Il y a déjà quelques confirmations, mais on attend leur confirmation définitive des membres qui y participeront. Et puis il y a également... Non, pas de point là-dessus. Voilà, en fait c'est tout. C'est tout pour les annonces de la présidence. Avez-vous des remarques? Ce n'est pas le cas. Les PV, les procès-verbaux des réunions précédentes, ils peuvent être adoptés. Voilà, ces formalités accomplies, je passe au point 7. Alors voilà un panel, nous avons eu un panel très intéressant ce matin avec un représentant de la Grèce et de la Belgique. Et nous continuons, nous passons cet après-midi à 3 autres intervenants. Madame Katharina Reich, qui est présidente du groupe de coordination de crise en Autriche, le GECKO, le professeur Jérôme Salomon, directeur général de la santé en France, et le docteur Rui Portugal, vice-directeur général de la santé au Portugal. Tous ces invités sont connectés à distance. Comme vous le savez, les interprètes sont encore en grève et ne traduisent pas les orateurs intervenant à distance. Je dois vous dire que cela met une certaine pression également sur nos hôtes. Je les remercie de bien vouloir parler anglais. Autrement, nous ne pourrions pas organiser du tout cette audition. Nous avons à peu près 2h30 pour cette discussion. Il n'est pas nécessaire de prendre tout ce temps, mais nous donnerons le temps voulu et nous passerons à des échanges sous forme de questions-réponses, comme un ping-pong, de questions et réponses immédiates. Je vous redirai exactement quelle sera la méthodologie. Eh bien, nous commençons donc la réunion par le point 7. La parole est à Madame Katharina Reich et juste après, Monsieur Jérôme Salomon, puis le docteur Rui Portugal, pour vos déclarations introductives. Madame Reich, nous vous voyons à l'écran.
Thank you for joining.
Merci de nous rejoindre. Vous avez reçu nos questions par écrit, n'est-ce pas? Je suis sûr que vous allez y répondre. Vous avez à peu près 10 minutes pour cette introduction. Vous avez la parole.
Hurry up. Thank you so much for this invitation. Yeah, dear ladies and gentlemen, the pandemic has presented all of us with major unexpected challenges over the past 2.5 years, and I'm pleased to share some of our experiences with you today. Furthermore, I look forward to engage in an exchange about pandemic management and to gain a broader European perspective on the impressions, processes and experiences of the pandemic management. I will, of course, be happy to answer any questions afterwards. So we have a PowerPoint presentation, and there is the first slide now. Maybe visible.
Yes, Mrs. Reich, we have the slides in front of us.
Okay.
Thank you very much.
I'm sorry, I don't see the slides.
No,
so.
but I think it's good that you say next slide if you want to move to the next slide.
Okay, I will do. We are at the first slide. So I want to tell how did we experience the pandemic in Austria. On February the 25th, 2020, the first infections were registered.
Wait, Mrs. Reich, just a moment.
We see, but the others, if there is no other screen, perhaps...
We have a technical problem.
Nous avons un petit problème technique, nous ne voyons pas votre présentation à l'écran.
What's that?
This morning it was there, no?
I believe all they have to do is they have to switch screens, because this screen is the one equal to here.
Shouldn't you switch the screens?
Me?
That one. No, not you. Sorry, I'm talking to the technical service. You're quite okay where you are. Switch the screens, no? Good for you. Thanks to my vice chair.
Merci à mon vice-président. Madame Reich, cette fois-ci, vous pouvez reprendre la parole.
I will start again. How did we experience the pandemic in Austria? On February the 25th, 2020, the first infections were registered in Austria. A nationwide lockdown came into effect on March the 16th, which was gradually loosened from Easter onwards and finally lifted on May the 1st. We observed the second wave of infections from September 2020 to January 2021. For this reason, the Austrian federal government introduced the compulsory wearing of masks in almost all publicly accessible indoor areas on September the 14th, 2020, and restrictions were imposed at events and the gastronomy sector from September the 21st. These were later also further tightened, like a lockdown light, and due to a continuing high level of infections, a second nationwide lockdown was necessary from November the 17th to December the 6th, 2020. After a brief relaxations of the measures, a third lockdown followed from December the 26th till February the 7th, 2021. This was also the time of hope for relief since the first vaccinations were administered on December the 27th. Like in most other nations, vaccine was limited at the beginning, and therefore we prioritized risk groups. Next slide, please. In March and April 2021, the number of cases increased again. In the course of this new wave of infection, the wild type was superseded by the alpha variant. In the course of summer 2021, a year ago, the Delta variant was able to assert itself as the dominant virus variant. A further lockdown was imposed from November the 22nd to December the 11th, 2021. This lockdown was lifted for vaccinated and recovered persons on December the 12th. The lockdown continued until January the 31st, 2022, only for unvaccinated people. Yes. At the beginning of this year, we observed another wave of infections. Since then, the Omicron variant and its subvariants have been dominating. In February 2022, wide-ranging openings were announced for March, and shortly after the openings, Omicron wave reached its peak to date. After a sharp decline in the number of cases, a renewed increase in the number of people infected has been observed since the end of May 2022. Now we are on the slide with the learnings. A pandemic of this magnitude highlights weaknesses and strengths in the public health system, and we have been able to gain and learn from many experiences. These, amongst others, include strengthening of crisis management to improve national coordination, e.g. through well-trained staff and sufficient human resources. Strengthening cooperation with experts. Increased research funding, but also the rapid establishment of a national and international exchange of data and information in order to be able to react more quickly and appropriately. Next slide, please. We take all these points to our account since, due to the erratic evolution of SARS-CoV-2, so far, the development of the pandemic is rather unpredictable. Various medium-term scenarios are the basis of considerations worldwide and also in Austria, depending in particular on the characteristics of new variants in terms of transmissibility, immune escape, and virulence. These characteristics lead to different effects in terms of case of numbers, severe disease courses, effectiveness of vaccinations and medications, and ultimately also the burden on the healthcare system. Different scenarios are therefore conceivable, from the ideal case, in which COVID-19 becomes a mostly mild respiratory infectious disease, to the worst case, in which there is an intensification of the pandemic. This would mean that new variants are highly transmissible and highly virulent, and severe cases cannot be adequately prevented or treated by existing vaccinations and medicines. At present, we are making efforts to prepare for the different scenarios in Austria. Next slide, please. All stakeholders involved in crisis management have learned a lot since the beginning of the COVID-19 pandemic, and at all levels, regional, national and international, strengths and weaknesses in the preparations made, the structures and institutional cooperation have become apparent. A key lesson of the last few years is undoubtedly to ensure the necessary increase in resources of the agency that provides scientific evidence and recommendations throughout the EU, our European Centre for Disease Prevention and Control. This is in order to enable measures to be taken based on them and to coordinate them more closely throughout the EU. In addition, a stronger global orientation and cooperation is necessary to ensure a faster response capability in the event of a crisis. The strengthening of the ECDC and the further development of surveillance systems, the possibility for training and improved crisis preparedness will also strengthen the member states in this respect. Therefore, the expansion of the ECDC mandate is an essential step towards promoting resilience and strengthening crisis resistance. However, the points already mentioned only represent the fractions of the lessons learned. It is important to use the findings and experiences effectively for preparedness and further pandemic response, especially due to the imponderability of the further development of the pandemic. So, next slide, please. Austria saw the high importance of data acquisition very early. Already at the beginning of the pandemic, Austria was able to make use of the epidemiological reporting system, our EMS, which is an electronic database for recording cases of notifiable diseases, which exists since 2008. The Austrian Agency for Health and Food Safety, AGES, was commissioned with the quality assurance of the EMS. This made it possible that the information contained in the system is available in a reliable and structured manner. In the course of the pandemic, however, the establishing of interfaces to other relevant registers, such as the electronic vaccination register proved to be necessary. The implementation of the national CAT tool, a reporting system and instrumentation for recording hospital capacities, made it possible to record the burden on the health system on a daily basis and to consider the data situation in terms of planning measures. On the other hand, the comparability of the international COVID-19 related data is a constant challenge for pandemic management. This concerns, for example, data gaps and uncertainties regarding definitions and parameters when collecting data in different countries. Furthermore, the difficulties in the comparability of case numbers and incidences due to different testing strategies and testing systems are worth mentioning. Thus, difficulties in the comparability of international COVID-19 related data, amongst others, led to challenges in deriving measures and making political decisions. Assessing the situation, such as a variant spread, and the effect of measures taken by countries that were affected earlier by new variants was often challenging. Next slide, please. Even though the past months have allowed us to gradually roll back the measures, a return to the old normality, meaning the time before the outbreak of SARS-CoV-2, will hardly be possible in one large or an abrupt step. Depending on the development of the epidemiological situation, considering the possibility of the emergence of more virulent or immunoevasive variants, substantial increase in incidences or hospitalizations, a reintroduction of obligatory measures to contain the incidence of infection may become necessary again at any time, especially in combination with seasonal effects in autumn and winter. NPIs should be seen as a cascade or ladder of escalation. In favorable epidemiological scenarios, a few isolated measures may be sufficient. In less favorable ones, more are needed. Thus, masks, access and distance rules, or increased hygiene measures become necessary again to protect us in the face of the burdens on our public health system and the threats to our health caused by the coronavirus. Next slide, please. I'm sorry. One back. We are already at the slide. So now the next slide, please. Yes. On the most important measures in this respect remains vaccination. However, according to a survey, about 13% of the Austrian population completely reject vaccination and cannot be convinced, even with the best communication measures. Another 4% say they are undecided. The fronts are really hardened and the image of the vaccination is damaged. This presents us, as well as other countries, with a major task. The Austrian federal government has launched an awareness campaign under the slogan "Vaccinated Together." In addition to classic advertising on billboards and magazine ads, this campaign also relies on social media and online advertising. In addition, there will be communication measures directly on site in Austria. These include personal counseling sessions and information events by doctors, experts and health workers in companies, schools, general physicians' offices, pharmacies, municipalities, associations, social institutions and so on. The campaign is planned to start at the beginning of autumn or in the late summer, as the general vaccination recommendation for the fourth vaccination is expected at that time. In addition, now we are at the last slide. In addition to the... Yeah, it's already... I'm sorry. It's already the... Yes, thank you. It's already the slide before. In addition to the protection of the population, the protection of the highly burdened health personnel must be taken into account in a larger context. Therefore, already at the beginning of the pandemic, guidelines were prepared in Austria based on the recommendations of the WHO, which set our measures for the psychological relief of nursing staff and doctors. In addition, a psychological advisory board was set up at the beginning of the pandemic, which also made suggestions for much needed improvement for the situation for employees in the health and healthcare sector, in the health and care sector. Recently, the Austrian Parliament passed a reform of the nursing care system to contribute to significant improvements in the healthcare system, especially for nursing staff. The pandemic has presented us with many challenges, but it has also given us the opportunity to learn and gain important experiences. We must use this acquired knowledge and draw the right conclusions from the challenges together in order to be best prepared for further health crises. So thank you for your attention, and I'm looking forward to answering further questions. Thank you.
Thank you very much, Dr. Reich.
Merci beaucoup, Madame Reich. Et je vais maintenant passer immédiatement la parole à Monsieur Salomon. Nous nous excusons, Monsieur Salomon.
Professor Salomon.
Sorry, please press the speak button, but only once.
Is it okay?
Yes, we hear and we see you. Mr. Salomon, you have the floor. Thank you very much.
Thank you very much, Mrs. Chair. Dear members of the European Parliament, it's a pleasure and an honor to explain what we learned from this pandemic in France. The European Health Team has been created and strengthened during this crisis, and I hope we now built a dream team. Maybe in a few minutes, the main lessons and key points viewed from France. First, we had to face an emerging pathogen and to deal with huge scientific questions and a high level of uncertainty. Since the beginning of the pandemic, a multitude of experts have been mobilized in France, and many committees have been created. At the national level, scientific expertise has proved to be essential to inform and support the public authorities in defining the health strategy by mobilizing and referring to health agencies and bodies. And at the global level, the contribution to the development of a French position within European and international bodies and better coordination has favored common scientific knowledge. For example, our health authority provided professionals with quick response sheets within the framework of COVID-19. Also, more than 70% of the Haut Comité of Public Health opinions were included in various publications, and our national agency, Santé Publique France, played a role in epidemic monitoring and risk assessment by, for example, defining confirmed cases of COVID-19 and the action to be taken. 3 new bodies to complete the scientific expertise system. A National COVID-19 Scientific Council, independent body to inform public decision-making in the management of the health situation. A committee of analysis, research and expertise to inform the public authorities, but focused only and more particularly on proposals for innovative scientific, technological and therapeutic approaches formulated by the French or foreign scientific community, and a scientific committee on vaccines to advise the government on the scientific interest of the various candidate vaccines and the advisability of conducting clinical trials. So we had a lot of data and, of course, indicators to analyze the situation, to support decision. We had an overview app, an interactive web application designed to replace the COVID surveillance application. And it provides basic maps, curves, and tables of primary indicators at regional and department level. So all these websites were, of course, open to public and very useful to support crisis management with, for example, interfacing different databases with strong legal constraint, but with certain interest about all the data about new tests, about new vaccination in France. And of course, we crossed all this database, and it was, of course, big data, but also open data. And it allowed international comparison by benchmarking all the various experiences of the different member states. So it was very important during the crisis to be able to compare all the measures taken at national and international level. For example, all what we did in terms of school strategies, testing strategies, contact tracing and isolation measures, vaccination strategies, control of variants, for example. Second point is how we managed a virus always evolving. So we had a strategy against variants, and of course the sharp increase in positive case caused by the Omicron variant was limited and delayed thanks to the rapid detection of its presence on the territory through active genomic surveillance based on two devices, screening and sequencing. The reinforced management measures, and in particular the sanitary control at the borders, aimed at delaying the arrival on the national territory of variants with worrying characteristics, and my colleague spoke about it. It relied on several actors, of course, risk analysis by Santé Publique France, the French national agency, but also transporters and the verification of travelers' health credentials. At the territorial level, under the authority of the prefect, civil security actors to carry out screening, border guards to check travelers' credentials, as well as internal security forces to control isolation or quarantine measures. So this strategy for the future is very important in terms of perspective, and we have to maintain this possibility after the crisis to be able to protect people from new epidemics or from variants in the future. At the Union level, from the start of the pandemic more than 2 years ago, it was clear that we needed to strengthen our cooperation and provide stronger legislation. But the European Commission has been able to react quickly to propose a legislative package for European Health Union, which proposed strengthening the mandates of the EMA and the ECDC, and the adoption of the new regulation on serious cross-border health threat, as well as the creation of HERA, is a very good point. So I'm sure that this legislative package will enable major progress to be made. I'm thinking, for example, about the establishment of the EU task force, a real intervention task force within the EU and beyond, and the establishment of a European network of reference laboratories. I'm also pleased to see that the role of the ECDC is reinforced. I would also like to welcome the new regulation on serious cross-border health threats. The French presidency of the European Union has worked towards this, and we can be pleased that an agreement has been reached. I welcome this decision, and I'm pleased that the French presidency has been able to accompany the first months of the implementation of a stronger ECDC at a more efficient and a more coherent health union. At the international level, it will be necessary to strengthen coordination of data sharing at the global level through the strengthening of the WHO event information side, but also strengthening the relationship between the EU and WHO Euro, and strengthen the international health regulations and reach an ambitious and binding international agreement on pandemic prevention, preparedness and response, and contribute internationally to the global expansion of genomic sequencing. About vaccination, and can answer all the questions you want, but we achieved one of the best vaccination campaigns in the world, with more than 55 million French people having received vaccination, which is above the European average, and of course vigilance remains necessary now as a new wave is on its way, and a new campaign is now done in France during this summer. So new questions arise, particularly concerning the vaccines to be used, which were Pfizer and Moderna were used massively during the campaign, but we have to adapt these vaccines to the new variants, especially BA4 and BA5. So the vaccine should arrive in autumn, and we are very vigilant on this point, of course, to be prospective to combat vaccine hesitancy on several levels, highlighting the recommendation of scientific authorities, scientific education, transparency, proximity of vaccination relays, strong mobilization of health professionals, and communication to the general public. But of course, we are all facing this hesitancy. I want to maybe highlight a very important point in France, which is fighting inequalities. Several types of outreach to vulnerable people were carried out during the vaccination campaign, especially actions were carried out with isolated elderly people, immunocompromised people, people suffering from comorbidities, people receiving treatments. and having social supports. Most of this action consisted of sending letters, email, phone calls, and text message. But, for example, I want to insist on the way that we had to use new ways of helping people, like going to marauding, mobile vaccination devices organized by partners associations, for example, to allow vaccination thanks to Red Cross, SAMU Social, Civil Security Association, but also go to places where people live and organizing vaccination in establishment, in social housing, hostel, day centers and everything, informal camps, food aid center. Take two, which is identification of people who are isolated and losing their autonomy through local actors, then transport them to vaccination, for example, and going to the home, organizing vaccination at home, thanks to the identification of people in a situation of isolation or loss of autonomy, and helping them through teams from hospital, social and work, town halls, associations. So it was very important to set all these permanent offices within the association to organize targeted mobile vaccination actions, for example, and to address the difficulties associated with travel. And we built very strong partnerships with local authorities and associations that work closely with these vulnerable groups. Last point is the most important point for me is anticipation and prospective action. For the pandemic, prevention, management and surveillance doctrines are based on an exceptional legislative and regulatory framework. Strategies for screening, case management and surveillance of coronavirus may differ from those in place for other viral respiratory infections, including influenza. As many other countries, we are currently working on an integrated and sustainable framework for the prevention and management of acute respiratory infection outbreaks, of course COVID, but also influenza, RSV or other respiratory viruses, by developing a surveillance strategy based on syndromic indicators, genomic sequencing and hospital surveillance in both conventional cares and ICU, organizing a diagnosis and testing strategy based on therapeutic choices, adapting management according to the characteristic virulence, isolation, treatment, vaccine prevention, etc., of the pathogen detected, and making individuals responsible for transmission prevention measures such as isolation, voluntary social contact reduction, masking in at-risk settings when symptomatic or after a contact at risk, contact warning, contact tracing, respect of barrier measures in order to reduce the risk of diffusion, and at the end, reinforcing health education and individual literacy for enhancing the collective adherence to barrier measures. However, these guidelines are intended to be flexible, reversible, and rapidly re-evaluated in the event of an emergence of a new viral variant presenting worrying characteristics, having a significant hospital impact. Thank you very much, and I'm ready to answer all of your questions, of course.
Merci beaucoup, professeur Salomon.
Merci beaucoup, Monsieur Salomon. Et je vais maintenant donner la parole à notre dernier orateur, le vice-directeur de la santé au Portugal.
The floor is yours, please.
Vous avez la parole.
Thank you very much, Madam Chair, for this opportunity. I'd like to, and addressing the special committee, the apologizes of the Director General of Health, Graça Freitas, who she is not able to be here today, so yesterday evening she asked me to do this and address you. Throughout this presentation, I hope I can answer all the 5 questions you have put to us. And actually, managing public health emergency on a more political perspective, there was in Portugal, the first slide, please. Don't move. The previous one, please. And next slide, please, now. Okay, it looks like it's missing one there, but it's okay. There was a very close political and technical dialogue between the government and their agencies in different levels, national, regional, and even local ones. Regular meetings at the national level with governments and experts took place almost at the very beginning, almost every 2 weeks, and that were transmitted on overall to the public in general. And so there was a very high transparency rate on the decision making on the governmental level. Actually, the government set up 3 different task forces, one for vaccination, one for testing, and one for communication, that strongly advised the government on making decisions. And that was a very fruitful task, actually. As well as there was a very close relation with the government and the 5 regions we have in Portugal, because they nominated a Secretary of State for each one of the regions in order to facilitate every intersectorial activities, mainly when we are talking about social security, economic, internal affairs, civil protection, and health issues. Municipalities had a very strong role in the management of the pandemics, mainly for attenuating inequities in their own populations. Also, there was a strong adoption of telemedicine on all the provision of health care. However, mental health at the very beginning was not a major issue which we should address in future needs, of course. The coordination of the government and the technical aspects were a major issue during this. Looking at question 1 you have put to us, we would say at this moment that yes, there was a very strong advice on the technical issues to the political ones. However, time for the political decision and time for technical expertise sometimes and a lot of times were not the same. We still need to work on this strongly. This slide actually just lights on the 3 in blood letters, 3 of the major issues my own organization had responsibility to work on. The preparedness and response plans, which we had mainly from the flu perspective, the epidemiological surveillance, and the public health and clinical guidance and recommendations. We are going to look at now, next slide please, to the technical coordination overview on 3 different aspects. The SARS infections, the SARS-CoV-2 infections, the disease itself, the COVID, and the outcomes. And we have 2 layers here. One is the implementation of measures, and the other one is the information system, very much related with the question 2 on the data collection and the comparison to other data from the European Union level. One of the things that's very relevant when you look at the data set is that we quickly had to adopt a more digital perspective on all of this. Actually, the surveillance with the CNAV on the registration of vaccines, when we're looking at the vaccines, and also when we look at the infection and the prevention as well as the disease, we set up a new system which is called Trace COVID-19 for the management and the public health perspective of all the disease, and an integrative system which we still are using. This is a very relevant issue when we are adopting and looking at these issues. Probably in the future we should need to, and will be advisable, to share information on the systems that the European countries have Of course, most of us, we had to implement new systems, and we learned about that on the previous speakers, actually, in a very quick way. However, now we probably have the time to share this kind of information for future requirements, as well as to feed the information at European level with a more digital perspective. The outcome, of course, is very much about death and other issues, which we also have an information system very much in relation to death. However, there will be a very good issue on, for instance, to better understand if the definition and the registration of the death and outcomes in different countries are more or less the same. Definitions. Sometimes it looks like it's different. So I hope we also give some information about question 2 with this slide. Please, next slide. On the other issue, it's very much the epidemiological surveillance. As you can see on our top right issue, there is a surveillance of the variants. And nowadays we have BA5. 96% of the population in Portugal, it's identified that is being infected with BA5, which is earlier than other countries in Europe, and that can be justify a little bit on the question 5 you have put about how do we have such a high level of rate of vaccination and still a very high rate of infections and death. The variant is different. As you can see on the left-hand side, there is the typifying of the variants in the country, and of course different variants gives different virulences, and the incidence varies tremendously. It is very it is expected that since Portugal had one of the first countries being hit by the variant BA5, that other countries will have a new wave in the coming days and weeks. As you can see on the left-hand side, and later on you can see it also, there is a 6th wave going on, and we are now moving to finishing actually the 6th wave of the pandemics in the country. It is quite relevant on the surveillance and the data collection, also looking at the vaccine effectiveness. On the right button, you can see how is so important being vaccinated on the outcome perspective. We can say that death, for instance, for 80 years and older that are vaccinated are 5 times less than people not being vaccinated. It looks like vaccines, it's not a very good thing or exceptional for acquiring the infection with the new variant, but definitely it's a great measure of preventing severe disease and death. Next slide, please. Also in Portugal, not just having the epidemiological surveillance, but the risk perception and risk communication helped us to handle and better communicate with the public. There was a weekly surveillance of the risk perception of the population on the way we were communicating. On the right-hand side, you can see a synthetic report of one of the weeks. And with this, we understood which kind of messages we should give. For instance, on testing, on NPIs, on the need of vaccination, and of course about the need of literacy of the population. Next slide, please. While we were doing the epidemiological curve, in the technical perspective on the risk management, there is several issues that came into force as norms in Portugal, starting with the case management, the contact tracing definition and strategies, the strategy of testing, the vaccination campaign, and how shall we vaccinate different people. And everybody knows what happened with the different vaccines for elderly and not elderly, for younger, for not younger, and so on. And the post-COVID and nowadays for specific therapeutics and with the new drugs. At this point, we are finished, as you can see. This is numbers for the last week. We are going down on the 6th wave, but still with a very high incidence. There was a lockdowns twice in Portugal, as you can see at the very beginning, and then when we moved from December to January 2020, 2021. Another question, question 5, was very much according, please next slide, the vaccination campaign. We would say that this is the strategy. We have really a very high rate, as everybody knows.
Dr. Portugal, just...
Yes, please.
Just, you're also already exceeding your time. Is it possible to speed up a little bit? Thank you very much.
We only have one more slide and I'll finish it. Thank you very much.
Thank you very much.
Let me just let you know that everybody knows about our very high rate. Mainly it's justified because of the great adherence of the Portuguese population of the vaccinations plans we have. Next slide, please, for the future. And very much addressing question 4 you have. We are very much concerned about the pandemic fatigue on the communication, and we are setting up several strategies on communication and using behavioral sciences into that. Of course, including vaccinations, not just for COVID as well as for flu disease, jointly at the very beginning on September. And last slide, please. We were being a pilot study in Portugal on the Universal Health and Preparedness Review in Portugal, which we are concluding now. And several things are coming, and this is very much concerning question 3 on what's going on. There are now being discussed new law on emergency on public health in Portugal, as well a new law on the reform of public health in Portugal to have the lessons learned from this pandemic into a new architecture of public health in Portugal. Also, we would like to say that it will be really important to have a European Union global health perspective to better prepare Europe for future challenges like those we have now being and of course, I'll be very happy to answer all your questions. And I'm sorry for taking extra time. Thank you very much, Madam Chair.
That's okay. Thank you very much, Dr. Portugal, and thanks to all the...
Merci beaucoup, monsieur. Et merci aux 3 orateurs pour l'introduction que vous avez donnée. Et ce qui est intéressant, c'est de voir à la fois les points communs et aussi les différences. Nous allons maintenant donner la parole à nos orateurs. Tout d'abord, les représentants des groupes, en fonction de la règle d'Hondt. Nous avons utilisé une méthode ping-pong ce matin. C'est ce que nous allons utiliser aussi, mais une petite remarque. Nous avons un petit peu de temps. Ça ne fonctionnera que si vous ne posez qu'une question, maximum 2, à un des orateurs, avec éventuellement un suivi. Je crois que c'est la meilleure façon d'obtenir une réponse, et pour nous aussi, pour nous en tenir au temps. Nous verrons avec les coordinateurs comment cela fonctionne. Ce qui... sinon, on ne comprendra pas si on ne s'astreint pas à cela, à cette règle. Monsieur Kim Korpoulos pour le PPE. Merci beaucoup, Madame la Présidente. Merci beaucoup aussi pour ces remarques. nous devons vous saluer tous, vous remercier pour tout le travail que vous avez réalisé pendant les 2 ans et demi. Je pense que c'était le test ultime pour nos systèmes de santé. Je voulais demander à Madame Reich à quel point cela vous paraît important d'inclure des structures psychosociales dans les systèmes de santé nationaux. Il s'agit d'assurer la continuité des systèmes de santé. Et à Monsieur Salomon, je voudrais vous poser une question. Quels sont les problèmes auxquels vous êtes confrontés en France et quel est l'état de la situation en matière de vaccination? Docteur Portugal, la mortalité a été importante au cours des derniers mois et si on a bien compris, les quantités ne sont pas suffisantes, mais comment est-ce que vous envisagez de traiter ce problème?
Reich, please. And please, in your answers, be also quite precise.
Madame Reich, donc que tout le monde soit strict.
Hello. I'm sorry, I didn't understand parts of the question due to microphone and technical issues. So currently, I'm not able to answer because half of the question was missing.
Okay, well,
is it possible maybe to write it in the chat?
Yeah.
And
Somebody
we
can...
make another turnaround.
Yeah. You will write it in the chat.
Thank you.
Chat, sorry, and we go to Professor Salomon.
Dr. Salomon?
Professor Salomon, please.
Professeur Salomon, vous pouvez appuyer sur... Merci.
Sorry. Thank you, Mr. Deputy, about your question. Your question is very important about all the problems we are facing in the scope of vaccination. I think key points are transparency and, answering questions from our population about all the questions about safety, about security, about benefits and risk of vaccination, about all the questions we have about the history of vaccination, the different types of vaccination, and we have to be absolutely transparent. The other point is transparency of experts, independence of experts, and of course research. So to date, it's not possible to comment on the future course of the pandemic, but we have a lot of studies, such as the INSAM study COVID Boost, which is underway, to study the effectiveness of vaccines used against severe disease, hospitalization, and death. And real-life data are very important and being closely monitored. In addition, our specialists are also involved in international research, and research at a European level is key to rely on studies that are correctly conducted in different countries in Europe. With regard to adapted vaccines, all the vaccines are currently developing, all the labs and companies are developing bivalent vaccines based on Wuhan, for example, strain and Omicron. And the combination of these strains makes it possible to cover the different forms of the virus that are circulating now. But we have to be very aware of the new variants, of the new results, of the safety and effectiveness data, and especially on the impact of this vaccination on the main risks, and of course the severe forms and the hospitalization levels. So these adapted vaccines must nevertheless obtain a European EMA and recommendation from our health authorities, and the strong collaboration between surveillance, genomic data, effectiveness, and security are key to obtain confidence from our population at a European level. Thank you.
Thank you very much. Dr. Portugal, please.
Docteur Portugal, 1 minute.
Thank you very much. Thank you for the question. It's a very relevant one. Mortality is very high because mainly the incidence in Portugal is very, very high. Mortality at this point is 26.5 per million inhabitants. But if you look at the lethality in the country, it's very low, which means that really the people are dying, mainly those with 80 and over, and we have a very whole population in the country. And the reason at this point, as far as we understand it, is that because the incidence is very high. Population has access to all the medications being provided and advised by EMA, and we have norms that people can use those medication for all of the population if needed, and we have access to those drugs in Portugal, mainly antiviral drugs. And I repeat, lethality, it's very, very, very low. Unfortunately, people, the incidence is still very high. Thank you very much.
Thank you very much. Dr. Reich, please.
Merci beaucoup, Dr. Reich, je vous en prie.
Did you receive the question?
Yes, so thank you very much for writing this in the chat. Yeah, we consider it very important. We had a separate board with psychological experts and psychiatrists, because there are special needs for children and for young people who missed school, who were at home for a long time. And we also had the board members with teachers and specialists for education. And now we changed the board system, and we included everything in the GECKO. It's our crisis cell commission from the chancellery, and there we have 2 members for psychological therapy and 1 psychiatrist for the special needs.
Thank you very much. Mrs. Cerdas.
Thank you, Chair.
Merci, Madame la Présidente. J'aurais 2 questions. Tout d'abord, pour le Dr Reich. Dans votre présentation, vous avez parlé de la nécessité de mettre en place rapidement des mécanismes de collecte de données pour pouvoir réagir plus rapidement. Et j'aimerais vous demander, que pensez-vous de la législation que nous avons récemment adoptée sur les menaces sérieuses transfrontalières pour la santé? Et quelles sont vos attentes par rapport à l'espace européen des données? Et je vais passer au portugais, donc je vais vous donner le moment de saisir vos écouteurs. Ma question s'adresse au docteur Rui Portugal. Bonjour, soyez le bienvenu au Parlement. Le Portugal est un des pays du monde où il y a le plus haut taux de vaccination avec un schéma complet. Dans certains pays européens, seuls 30% de la population est vaccinée complètement. Et ceci est probablement dû au cas de mortalité très élevé encore récemment au Portugal. Et c'est pourquoi j'aimerais que vous nous disiez quelles sont les pratiques et de quelle mesure ces pratiques pourraient être répliquées dans d'autres pays de l'Union européenne où la population est encore très réticente à se vacciner. Et toujours par rapport à cette réticence à se vacciner, qui est une réalité malheureusement dans beaucoup de pays, vous avez parlé de la vaccination et des non-vaccinés et du risque de mortalité et des bénéfices de la vaccination. Est-ce que vous pourriez revenir sur cet élément? Merci beaucoup. Dr Reich, je vous en prie.
So, hello, thank you. We are not. It's not clear what is meant with the border health threats, because now we have a system in Austria where we can make a difference between results from PCR and from sequencing testing, and our variant screening, and we have exchange when people cross borders, and we have a sign of a special variant or a rare variant. We can detect it rapidly and have an exchange with the other countries, where does the person come from, and with the HWRS system.
Thank you very much. Dr. Portugal, please.
Merci beaucoup. Le docteur Portugal, je vous en prie.
Thank you very much. Of course, I'd like to say hello to Dr. Sarah Sirdes. We know each other. But it's a very good question, and I'm pleased to answer it. Yes, the previous member of the European Parliament asked about mortality. Actually, it's very high, but it will be much higher if we didn't have the rates of vaccination as we have. Actually, according to our figures at this moment, we have for a second booster for the population with 80 and more years, almost 50% already. We have almost 100% of the people with 80 and over vaccinations, full complete vaccination, and over 95% with the first booster. Rates are a little bit different according to age. Actually, they are very higher when you have the population with 50 and more years comparing to the other populations. Still, 25 to 50 years of age, we have almost 100% of the population vaccinated, fully vaccinated. And with over 80% of that population with the first booster, which is quite interesting. But, for instance, for the population with 5 to 11 years of age, the fully vaccinated population is around 40%. There is a lot of justification for this because people have a previous infection, so they are not eligible for the vaccination. One or two things you already mentioned the very much on how people, the adherence of the Portuguese population to vaccination. It's very high. We have 98% of children vaccinations with the usual vaccination. So parents and grandparents, they follow that behavior in a way. On the other hand, you need to have vaccines. If you don't have vaccines, you can have a high rate. Another thing is very, very relevant, and it worked perfectly in Portugal, was the logistics. There was established a very good logistics, and the vaccines were everywhere, and they still are. So it's very easy for people to be vaccinated with messages, texting to their phones, and these kind of issues, as well as, finishing, having a very good system on monitoring the risk communication we have of the populations, to better understand what is needed for people to have the vaccines. Thank you very much.
Thank you very much, Dr. Portugal.
Merci beaucoup, Dr. Portugal.
Présidente, alors je voudrais d'abord remercier les intervenants et à travers eux le formidable travail qui a été mené par toutes les équipes en première ligne pour l'épidémiologie ou la vaccination. Madame Reich, au début de la crise, nous avons assisté entre les pays européens à un manque de comparabilité des données et d'interopérabilité des systèmes de surveillance. Est-ce que vous considérez que la Health Task Force et les critères communs établis par le CDC ont amélioré la situation et comment verriez-vous qu'on fasse encore mieux dans l'avenir? Monsieur Portugal, vous êtes dans un pays qui porte votre nom, dans lequel vous avez à la fois une forte propagation du virus, mais un taux élevé de vaccination et donc une atténuation des signaux de la maladie. Dans votre stratégie, est-ce que vous êtes en train de privilégier plutôt zéro Covid ou plutôt la diminution de la mortalité spécifique ou la protection des systèmes de soins ou la protection de la santé mentale des citoyens ou de la santé économique du patient, du pays? Et enfin, Monsieur le directeur général, cher Jérôme Salomon, nous avons également assisté pendant cette crise à des fermetures de frontières, à des stratégies divergentes d'isolement, de testing. Vous avez évoqué les instances nationales et en particulier le Haut Conseil de la santé publique en France, mais je ne sais pas si vous êtes informé du fait qu'il y a un Conseil scientifique européen. Si vous en êtes informé, est-ce que vous y avez participé? Et sinon, comment pourrait-on améliorer sa visibilité et sa composition et ses missions? Merci beaucoup.
Merci beaucoup. Dr. Reich, please.
Oh, hello. We appreciate that the Health Union establishes common indicators for comparability, and we are yet struggling to compare these data. So we are highly appreciating this establishment for this common indicators.
Thank you very much. Dr. Portugal.
Sir, you pressed twice the speak button. You only needed to
Okay, thank you very much. Merci beaucoup pour les questions. This is a very good question, and the strategy in Portugal at the very beginning, as the other countries, was first of all to have the less impact as possible on the death rate, and of course allowing that the severe disease and protection of the health system would be a certainty as much as possible. Meanwhile, there was a very good discussion and dialogue about the main issues on the mental health and the economical perspective. They are all together. We can't say that one is better than the other one. The question here is very much to establish a better understanding what the population of what the Portuguese want to have in different moments of the pandemic, and actually getting the advice of that people, of ourselves, we were able to better understand and establish the policies in the country. But of course, death and the protection of the health system and mental health are very relevant issues. Thank you very much.
Thank you very much, Professor.
Merci beaucoup. Professeur Salomon, je vous en prie.
Only press once.
Merci beaucoup, Madame la députée, chère Véronique Trier-Lenoir, for your question. It's a very important question about the European level, and of course, I think we are now observing the birth of the Europe of health, which is something very important, a very positive point, a very positive aspect of this crisis. You asked me about the participation of France during the numerous meetings of the Scientific Council. I didn't participate on myself, but I want to say that we created a very important new organizations during these 2 years of crisis. For example, the new European Health Data Space, the new legislative package, the EU Health Task Force, the new regulation on serious cross-border health threats. We strengthened coordination at EU level, and I could mention HSC, EMA, ECDC, and of course the new ERA, and I am a member of the board. So I think really there is a new generation of very important European tools which are now important for the future. And maybe the next step will be to build a very strong strategy at a European level to work from the north to the south to help different countries from Europe, and also to organize a very strong relationship between the European Commission and the European institutions, and of course the European Parliament, with WHO and especially with WHO Euro. Thank you very much.
Merci beaucoup. Mrs. Metz.
Thank you, Chair, for giving.
Merci, Madame la Présidente. Tout d'abord, une question pour le docteur Portugal. Imaginez que vous puissiez revenir en janvier 2020 avec toutes les connaissances que vous avez engrangées jusqu'ici sur la pandémie. Quelles seraient vos recommandations à l'attention de votre gouvernement par rapport à ce que l'Union européenne devrait faire différemment? Ça, c'est pour le docteur Portugal. Ensuite, j'aimerais demander au docteur Salomon comment il estime qu'à l'avenir, les États membres pourraient faire de mieux pour atteindre davantage les personnes les plus vulnérables d'un point de vue social qui sont réticentes par rapport à la vaccination ou qui sont difficiles à atteindre plus généralement. Quelles sont vos réflexions à ce sujet? Comment faire en sorte de mieux informer ces populations? Et puis, pour le docteur Katharina Reich, à vos yeux, est-ce que des échanges de vues réguliers avec vos collègues européens seraient importants? Est-ce que ce type d'échange existe? Est-ce que vous pensez que l'Europe devait créer davantage de possibilités pour encourager ces échanges entre collègues européens? Merci.
Mrs. Metz.
Merci beaucoup, Madame Smith. Docteur Portugal, je vous en prie.
Thank you very much for the question. What do you recommend differently? First, at the very beginning, this was very much thought as a pandemic, and actually is a syndromic, which is very different. So, which is that at the very beginning, we should have immediately tackled this in a very much broader perspective than we did at the very beginning. For instance, with intensive care units and these kind of issues. Secondly, immediately tackle inequalities at the very beginning. And thirdly, this is a global issue. Even European Union borders are outside the continent of Europe. And this is a human perspective. And global health is a very important issue, not just for each one of the member states, for the overall of the European Union. Thank you very much.
Thank you very much. Dr. Salomon.
Thank you very much for this very important question. Maybe two points about preparing for a future wave or a future pandemic. We need to strengthen our research capacity and vaccine production at a European level, I'm sure, to ensure the performance of our epidemiological surveillance and the availability and interoperability of information systems, and finally to strengthen research in the human and social sciences. So your work, your legislative package is a very important progress in this regard. In a long-term perspective, a national level, a global approach, and a sustainable strategy to increase public support, for example, for vaccination, would improve the use of vaccines. And we need a multidisciplinary approach, a global health approach, to intervene and mandate to promote adherence to vaccination among the various publics. So combating vaccine hesitancy is something very, very difficult, but we need, of course, to work together. The second point is how to deal with very fragile, vulnerable populations. And we have to understand that these populations are always the first and the main victims of a crisis. So first priority is fighting against inequalities at a social, territorial, and of course access to information level, to give the possibility to have access to diagnosis, to prevention, to education, prevention, promotion, vaccination. So we have a lot of tools. I'll talk about it in my first talk, but really I have a major point, which is deal with and be very, very cautious about the mental health priorities, about the impact of a crisis on mental health, especially in children and in all the teenagers. And I think access to health, even for other problems, is something we have to organize during a very severe crisis. Thank you.
Thank you. Dr. Reich?
We have to say we appreciate the exchange of view with ECDC. It's most essential for us, and this works very well. On a technical level, we value the regular exchange also with HERA and HSC. But however, we strongly recommend to be very attentive that we do not duplicate the work in the boards. So every board has to maintain its specific topic, and for the future we definitely recommend to exchange on preparedness activities and to ultimately reach a harmonization in the future response phase.
Thank you. Ich würde gerne meine Fragen an Frau Dr. Reich richten. Frau Dr. Reich.
Madame Dr. Reich, vous avez dit clairement dans les médias qu'il faudrait une 4e dose de vaccin. Cependant, l'obligation de vaccination a été levée en Autriche. Quelles en ont été les raisons qui ont conduit à cette décision? Et puis, je l'ai déjà dit ce matin, en Allemagne, d'après l'Institut Robert Koch, 82% des hospitalisés pour Covid étaient vaccinés. Alors, qu'en est-il en Autriche et qu'en pensez-vous? Est-ce qu'il ne faudrait pas avoir une sorte de vaccin et enfin, que le vaccin plutôt soit quelque chose de privé, puisque ce n'est pas une vaccination qui empêche la diffusion, qui protège juste des formes graves. Alors, il y a eu apparemment 2,5 millions de patients qui ont été traités à cause d'effets secondaires pour les vaccins. Y a-t-il des données pour l'Autriche et quelles sont les données s'il y en a?
Okay, sorry. Ich kann nicht auf Deutsch antworten. Wäre etwas einfacher?
I'm so sorry. I feel really very embarrassed, but you cannot. And I know you. But
so,
take your time.
I need some seconds. Okay, so to the Impfpflicht, to our mandatory vaccination law. In support of the introduction of the mandatory vaccination law, a commission was installed to regularly assess the necessity of this compulsory vaccination. And due to the epidemiological situation, the Commission's assessment came to conclusion that it is not necessary to focus on compulsory vaccination at present. Therefore, this mandatory vaccination was suspended. And first suspended, and recently the government decided to completely repeal this mandatory vaccination act. And the contribution of vaccination with regards to the management of the current pandemic shall, however, not be questioned. this especially holds true with regards to reducing severe disease curses, and that's the main point. Because I do not think it's a private case when you have a need for a public healthcare management, and you have the need for this public healthcare treatment, and the vaccination can reduce these severe disease curses. So I think in the situation we have now, in this epidemiological situation, where we have slightly reaching our public access, our free public access, there I don't think it's a private case. And the side effects you mentioned, investigations are ongoing. We have a data collection on these side effects, and there are not only side effects notified, also they need to be investigated. Yeah, there are many kinds of cases which are compared with a possible vaccination or the vaccination date, and we are not yet ready to publish this data. And as long as EMA approves, we will support this vaccination and the publicity and the publicity access to it. And possible effects are more than the side effects, and especially when it comes to this hospitalization.
30 seconds. 30 seconds.
30 secondes. Hein.
Vielen Dank.
Merci beaucoup. Tout particulièrement, ce qui m'intéresserait aussi, c'est la question des effets secondaires. Bon, apparemment, ce n'est pas connu encore, mais qu'en est-il des hospitalisations de personnes vaccinées? Est-ce qu'il y a des chiffres qui seraient comparables par rapport à l'Allemagne?
There's an echo. Okay. Currently, we are collecting the data from the hospitals, and there are about half, 50%, half of the people who are treated in the intensive care unit who are not vaccinated or not completely vaccinated, like three vaccination
doses.
Doses, yeah, okay, yeah.
We understood.
I thought from this German to English, it's
yes.
Sometimes a little bit complicated. I'm sorry. So half of the people are not completely or not fully vaccinated, and other people are vaccinated, but COVID-19 is not the main diagnosis. For this hospitalization. So we established this register for our hospitalization COVID-19 cases in combination with infection and vaccination about 3 months ago. Before there were only a complete data of COVID-19 and infection beds, and now we have this register. But it's since about 3 months, and we are now collecting this data, and it's now possible to have a detailed view of these patients.
Okay, thank you very much, Dr. Reich. Meneer Roos.
Meneer Roos, je vous en prie. Monsieur Roos. J'aurais 2 questions. Tout d'abord pour Monsieur Salomon. En ce qui concerne l'OMS et les informations décembre 2020, on peut lire qu'il y a un risque élevé de taux positifs après l'infection. Donc les résultats des tests uniquement doivent-ils être confirmés? Et C'est une information très importante car lorsque des personnes en bonne santé ont un test positif, on estimait qu'elles étaient malades, quels que soient les symptômes. Les personnes en bonne santé étaient donc contraintes de rester chez elles et ceci a entraîné beaucoup de problèmes dans le secteur de la santé, mais également et dans le monde du travail plus largement. Et est-ce que ces recommandations ont été prises en compte dans le cadre des protocoles dans votre pays? Ensuite, pour Madame Reich, suite à la pandémie de Covid, une exposition à une souche pourrait vous empêcher de produire suffisamment d'anticorps contre une nouvelle souche de virus. Et donc, ceci réduit les capacités du système immunitaire. Et donc, donner des rappels de vaccins pourrait entraîner davantage de difficultés à l'avenir. Alors, où est-ce qu'on fixe la limite pour les rappels, en particulier pour les enfants? Et en Autriche, je pense au cas des personnes qui ont été obligées de se vacciner. Merci.
Very much, Mr. Solomon, Dr. Solomon, sorry.
Yes, thank you very much for your question. It's very important, of course. I think you are talking about false positive tests. And of course, we are all facing this question of high-level quality test. So there is a quality control policy at the national and European level, and you can see on the website of the European Union the list of the tests which have been tested in terms of quality and the level, the objectives of this testing at the European level is to be sure that the tests are very good in terms of sensitivity and specificity. Second point is you can have a test positive without any symptom, but you can transmit the virus even if you don't feel any symptom. And we have many tools, auto-test, antigenic test, access to PCR, screening and sequencing which allow us to obtain a very strong epidemiological and virological surveillance system. Thank you.
Merci beaucoup. Dr. Reich.
I have to say in Austria, nobody was forced to get vaccinated, and we never forced people. We only considered a fee for people who are not vaccinated, and the law was never set into force. So I have to make this clear. But set up in preparation for an epidemiological situation, we need everybody to be prepared and to be vaccinated in this main part of these three first vaccinations. And we for the number of vaccination and the time between the boosters, we follow the scientific recommendations from EMA and the Austrian Vaccination Committee. And we'll, of course, rely on these recommendations for our measures. And vaccines are always a prophylactic action. And
healthy people.
Yes, and so our healthy people are vaccinated. It's a vaccination not for people who are already ill. There are medicines and other treatments possible, but healthy people are vaccinated. And now the fourth, it's also the first vaccination after the three after the three main first vaccinations. This first or the fourth vaccination is for the mostly elderly and the chronic ill. So about at the age of 60 or the age of 65, EMA recommended the age of 60. We have data from 65, so there is not much difference between that. And it's recommended for the elderly and for the chronic ill people. And later on, maybe there is another data needed, and our Austrian Vaccination Committee is collecting all the national and international data. We have a recommendation for the other ones, like healthcare workers and workers in any risk settings. And we think that the elderly and the chronic ill or the chronically ill people are at a high risk for severe diseases, and we have to protect them for this severe curses and for this hospitalization, where they have a high risk to die or to have a long-lasting complication of this COVID-19 disease.
Thank you, Dr. Reich. 30 seconds.
Yeah, one extra question to Mr. Solomon.
Alors, une question à Monsieur Salomon. Vous avez dit que les gens asymptomatiques pouvaient transmettre le virus. Mais c'était le cas aussi pour les vaccinés. On s'est aperçu que le vaccin n'empêchait pas la diffusion, la transmission. Et ces gens, eux, pouvaient aller au restaurant, à la salle de sport et même ici au Parlement. Pourquoi est-ce qu'on n'a pas décidé alors que les gens vaccinés aussi se fassent tester à ce moment-là?
Only once. Yes.
It's not working.
Professor Solomon.
Yes, that's strange because I have many colors on my control. Sorry. No, that's a very important question. First point is the efficiency of vaccine, and all my colleagues insisted on this point. The vaccine is very efficient on the risk of death, on the risk of severe cares, on the risk of hospitalization, but is less efficient, and it's very well known, on the transmission. So when you are vaccinated, the risk of having the virus, and especially of having symptoms, is decreased very significantly. So that's the first point, and a very good point for vaccines. Of course, you can be tested in very different areas. You are asked to wear a mask when you are entering in France, hospitals, for example, or care settings, and you have to be tested, and that's why we are insisting on the access to tests. And it's very important to add that, in France, serological tests, for example, are not recognized as part of the health pass and do not allow a certificate. So we have to be maybe aware that there are many situations, especially now, of reinfection. The level of reinfection is very high in Europe. So on the other hand, we are very much welcome the possibility of issuing recovery certificates for people who tested positive. And in the context of the exponential increase in the number of cases during the Omicron waves, because we are still in an Omicron wave, mutual recognition of diagnostic test types at EU level, but also of vaccine, are essential tools to facilitate the movement of citizens. So we have to be all aware about the impact of vaccination, the importance of being tested, the importance of respecting barrier measures. Thank you.
Sorry. Mrs. Matthias, please.
Thank you, Chair. And
Madame Mathias. Merci, Présidente. Merci à tous d'être présents et merci à toutes vos équipes qui ont travaillé sur ces questions difficiles dans de nombreux pays. Alors, beaucoup de questions ont déjà été posées. J'ai encore une question à poser en portugais au docteur Portugal.
Voyons, comme je le disais, je voudrais vous remercier du travail qui a été réalisé. C'était des périodes vraiment difficiles. Et en reconnaissant vraiment les efforts réalisés, la difficulté du contexte, je pense que certaines dimensions n'ont pas fait l'objet d'une communication suffisante alors qu'elles sont si importantes dans la lutte contre la Covid. La Direction générale de la santé au Portugal a toujours été plus préoccupée par les mesures techniques dans le domaine de la santé, ce qu'on peut tout à fait comprendre, mais il y a aussi la question des conditions de vie des populations et on n'a pas dit grand-chose sur des conditions qui rendent des populations encore plus vulnérables, le cas échéant. Je voulais vous demander si vous pouviez vous exprimer un petit peu plus avant sur les déterminants socio-économiques et ce qui a été fait, parce que vraiment c'est un domaine dont on n'a pas beaucoup parlé en matière d'intervention publique et dans le travail de la Direction générale de la santé.
Thank you very much. This is a tremendous question, and I think all of the three of us were in remote. We all have talked about that. It is true. This week, actually, it was published a study in Portugal telling that vulnerable populations with conditions economically on housing and other aspects really were hit by the pandemics more heavily than everybody else. That's why I talked a little bit before about the syndromic perspective and not the pandemic perspective. I totally agree with that, and that was one of the things we learned this. And let me also give you some, I think, good practices. Municipalities in Portugal, and I'm sure all around Europe, were one of the backbones of giving means for challenging inequities in local populations and trying to minimize the impact of the pandemics for those more vulnerable, mainly economically and socially. For instance, migrants populations as a whole. I totally agree that we need to do more, and I hope that the European organizations, institutions will give member states more advice and more means to tackle these aspects. You are totally right on raising those aspects. And of course, we are sorry for not doing more than we could do, but we did a lot, I would say. Thank you very much.
Thank you very much. That's okay.
I don't know if the other wants.
Merci beaucoup. Alors, je ne sais pas si d'autres souhaitent intervenir sur cette question des conditions économiques et sociales. Bon, très bien. Alors, merci beaucoup.
Mr. Luco, please.
Thank you.
Merci, Kathleen. Moi, je me limiterai à une question, à un seul expert, mais une phrase d'abord. Ce matin, j'ai parlé du Covid long. Et on m'a dit qu'il fallait plus de temps pour collecter les données, etc. Mais aujourd'hui, les personnes souffrent. C'est aujourd'hui qu'ils souffrent, ont besoin de traitement. Beaucoup de patients également vont apparaître avec ce Covid long. Et il faut répondre à la souffrance. Donc je ne pose pas la question, mais je voulais faire cette déclaration haut et fort. Alors, c'est avec admiration, Madame Reich, je dois vous le dire, que je regarde comment l'Autriche a mené sa campagne de tests PCR pour détecter efficacement les infections et nourrir les bases statistiques. J'aimerais vous demander comment l'Autriche a pu s'en sortir aussi bien, sans faire de doublons. En Allemagne, on nous dit qu'on a eu des difficultés parce que les tests PCR étaient presque trop nombreux. Alors, j'aimerais que vous nous disiez ce qu'il en est. Merci beaucoup. Dr. Reich, vous avez la parole.
Okay, thank you. Yes, it's public that Austria has a special kind of testing system. We have established the alles Gurgeld, so everyone's gurgling. It's a special program where our capital Vienna was in charge to develop an easy and mostly digital system to make it easy to give a sample at home and to provide it to the laboratory. And there is only one big laboratory in Vienna who is collecting these samples. So it's easy for one laboratory to have to establish this testing system. For the other countries, the federal countries in Austria, it was not that easy, but it was Beispiel.
Example.
Vienna was a easy and big example how to do it, and Vienna helped a lot to establish this simple but quite effective system. And each laboratory with a big enough to have these samples reach this system and reach this turnaround, and especially for the detection of the variants, this PCR system was very helpful, and we are happy that we have this system established for the new and ongoing waves, and it's it was a process ongoing for the last 2 years, so it was not suddenly established, but we had it in a nutshell in Vienna, and so we have similar possibilities in the other countries. In Austria, it was an establishing process over the last 2 years, but now I think we are prepared for the next waves.
Thank you very much.
Just very briefly, so the hurdles in the other.
Merci. Alors, les obstacles dans les autres régions en dehors de la capitale Vienne sont dus à des problèmes de capacité. Alors, est-ce que vous pensez qu'on pourrait copier-coller le système pour l'adapter à d'autres pays?
There was a logistic. There were logistic troubles because Vienna is a capital. It was easy, but in the other federal countries there are cities and there are plain and long ways to have the sample and to have the laboratory, and this logistic system was not that easy, and we have the Alps, and so we are in a small country but with very different regions and possibilities to access these laboratories. But many other countries already visited us and took a look on our system, and we discussed the system bilaterally with many member states, and they visited also the big laboratory in Vienna and copied some kind of part of the system. So already many member states were visiting us.
Thank you very much. And now to my vice chair, Mr. Gluck.
Yes, thank you very much, Chair.
Pour mon vice-président, je vous donne la parole. Merci beaucoup. Merci, Madame la Présidente, et merci aux experts. Alors, le nom de notre commission parlementaire s'appelle « Tirer les leçons de la pandémie ». Et nous voulons le faire aussi en Allemagne. Il y a eu un comité d'experts en Allemagne qui a évalué les mesures politiques. Et on voit que les mesures de confinement auraient pu être prises au tout début, mais l'efficacité en a diminué très rapidement. Idem pour l'acceptation publique d'ailleurs. D'où ma question au docteur Reich. Qu'en pensez-vous? Avez-vous entendu parler de ce rapport? Est-ce que cette conclusion peut être généralisée à l'Europe? Deuxième question, toujours à Madame Reich. Parfois, je me pose la question, que se serait-il passé en 2020 si on avait eu les connaissances et les capacités que nous avons aujourd'hui? Si on avait reconnu, par exemple, le fait que les masques aident, parce que je vous rappelle qu'on se moquait des Chinois et des Asiatiques qui portaient des masques au début, les avancées technologiques et la capacité de produire des vaccins à messager ARN, ainsi que le renforcement de nos capacités, qu'est-ce que cela aurait changé si nous avions eu toutes ces armes dès le début 2020? Merci.
So it's on me, I think. I'm sorry.
Yes, Dr.
Yes,
Reich,
okay.
yes, please.
Yes, I'm sorry. we know this report you mentioned, but I'm sorry we cannot reply on that because I'm Chief Medical Officer and no politician, and I think it's a political question. And what we learned is that we should not rely on each wave, and now the wave is over and everything is over. So I think we learned that we cannot predict in this pandemic, and we have to be very, very flexible. And this is a constant process of lessons learned. And yeah, this is why we're happy to discuss our experiences. But we think the virus is evolving, and it was a different virus at 2020, a different virus, more different viruses in 2021, and now Omicron has again changed everything, and so we have chronically adapt with this virus evolution, and so the people have to adapt, and so our measures need to be different, and we cannot take measures from 2021 and to copy and paste it to 2022. So I think it's really necessary to focus on this forced flexibility in logistics, forced flexibility in our mindset, and not only the politicians or the responsibilities, also the public, the people in our country have to be really flexible and adaptive, and this is one of our major lessons learned. So we cannot predict now. We can think in scenarios. We have 4 scenarios, and in each scenario can be in a main maybe simple view for the people, but most of the waves and the ongoing epidemiological situation is really difficult to predict and to adapt.
Mr. Gluck.
I just want to come.
Monsieur Gluck. Oui, je reviens à la première question, qui est une question un peu politique. Quel est votre avis? Est-ce que les mesures de confinement étaient utiles uniquement au début, ou est-ce qu'elles étaient utiles aussi en fin de crise ou pendant la crise de la pandémie? Est-ce que les confinements ont perdu en efficacité? Dr. Reich.
Okay, maybe I didn't understand the full question. So I think the lockdowns were necessary at all parts of our pandemic situation, because our hospitals were full, and we had no possibility to wait. And we had this vaccination process, but we had also this hospitalization process, and it was not quick enough. It was not quick enough. So vaccination and hospitalization. So lockdown was the only possibility. But I think it's not the main possibility to treat this pandemic with further lockdowns in the future. So we learned, we have an immunization status in our public in our countries at the people, and so because that is the main cause, I think we probably do not need any further lockdowns, but nobody knows.
Indeed, thank you, Dr. Reich. Nobody knows.
En effet, Dr. Reich, personne ne sait.
Bonjour Madame la Présidente. 2 questions pour le professeur Salomon et Monsieur le professeur Portugal. La situation sanitaire des régions ultrapériphériques et singulièrement dans les Antilles-Guyenne est particulièrement préoccupante. Nos territoires sont très densément peuplés et les zones habitables particulièrement exiguës. Cela explique la fulgurance des contaminations et les nombreux clusters qui s'y développent. Actuellement, le taux d'incidence est reparti à la hausse, avec un taux de positivité de 20,5% en Guadeloupe la semaine dernière selon l'ARS, l'Agence régionale de santé. Cependant, le taux de vaccination est particulièrement faible aux Antilles françaises. Moins de 30% de nos compatriotes ont un schéma vaccinal complet. Cette défiance à l'égard de la vaccination, qui se retrouve un petit peu partout en Europe, est d'autant plus exacerbée dans nos territoires. Pourtant, il est indispensable de protéger nos populations, respecter leurs choix, bien sûr, mais aussi et surtout leur permettre d'avoir accès à un système de santé adapté. Nos établissements de santé sont exsangues et ne peuvent pas répondre à toutes les nouvelles vagues. Professeur Salomon, pourriez-vous nous donner votre sentiment quant à l'évolution à l'avenir de ce virus dans ces territoires ultrapériphériques? Quelles seraient vos préconisations spécifiques pour ces territoires et comment encourager la population à se vacciner et d'autre part les rassurer quant à la réponse d'un point de vue sanitaire que nous pouvons leur apporter? Et les dernières questions pour le docteur Portugal. Constatez-vous également une hésitation vaccinale importante à Madère et aux Açores face à cette vaccination et quelles politiques publiques spécifiques ont-elles été mises en place sur ces territoires? Je vous remercie.
Professor Solomon.
Thank you, Mrs. Chair. Merci beaucoup, Monsieur le député européen Max Orville, for this very important point about the specific needs of the populations in French Caribbean islands. And as you know, we are very involved in helping Antilles populations, and they have not all the same level of reluctance for anti-COVID vaccines. While they are correctly vaccinated in the Indian Ocean, in the Pacific, or even in Saint-Pierre-et-Miquelon, vaccination rates, as you explained, remain very insufficient in the Antilles and Guyana, with the risk of new deadly waves. So vaccination reluctance is not limited to reluctance to RNA technology. Indeed, the vaccination campaigns with the Johnson and Novavax vaccine did not make it possible to significantly increase the vaccination rates, which testify to a more general distrust of vaccination. The action undertaken have been numerous. Information from health professionals there in Antilles, massive communication campaigns, use of outreach tools, including with local populations speaking local dialects in certain territories. However, there remains mistrust towards a tool considered even more so than in mainland France as ineffective or even dangerous, which sometimes strong support for conspiracy theories massively relayed on some social networks widely used in the Outre-mer as elsewhere as a source of information. So the arrival you described of the Omicron variant, considered less dangerous, has further contributed to slowing the dynamics of vaccination in the Outre-mer as elsewhere. So we are facing and combating this wave. You mentioned the level of positivity rate, which is 20% in Guadeloupe, for example, but it's 31 in Paris. No, so we have to be aware of this new threat, this new wave. We are also very involved and concerned, and I want to insist on this point, by the number of patients, because we are observing complications, especially long-lasting COVID. And it's a very important point for me, mental health, of course, the inequalities in health, but also long-lasting COVID, because thousands of patients, even maybe millions of patients in Europe, have to be listened, to be followed, to be recognized, and to be treated. And there is a huge effort to develop research on this very specific topic at a European level. Thank you very much.
Dr. Portugal?
Docteur Portugal,
Pour la question. It's Madeira and the Açores, they are autonomic regions. So they have their own health system and they are adapted health system, and they are a little bit different from the one on the continent. I may say that in Madeira, the rate of vaccination is 90%. It's a little bit less in Azores Island, mainly in one of the islands, the biggest one, where in Ponta Delgada, where is the headquarters of the government there. They have their own system, and I'm sure, and I know that they have their own campaigns for vaccination. We, of course, are giving them all the advice they need for helping growing their rates, of course. But I can tell you that their death rates and also the intensive care units, they are okay at this moment. Thank you very much.
Thank you very much. Mrs. D'Amato.
Thank you, Chair.
Bien, moi je voulais poser une question. Partons du principe que nous sommes tous d'accord. Nous sommes tous d'accord pour dire que la privatisation des connaissances pharmaceutiques, surtout sur les vaccins, est une chose non durable. Et donc j'aimerais savoir ce que pensent nos invités de la proposition de créer une infrastructure publique européenne pour la recherche et le développement de produits pharmaceutiques. Ce serait une proposition donc une structure qui serait dotée des ressources suffisantes pour gérer la majeure partie de la recherche en interne. Donc il y aurait donc également des droits de propriété intellectuelle sur les produits découverts, et cela passerait par des accords contractuels éventuellement avec des parties tierces. Cette proposition irait dans le sens justement de diminuer l'influence des entreprises pharmaceutiques privées et des compagnies de conseil, je pense à McKinsey en France par exemple, qui influencent les décisions des gouvernements, notamment sur les plans de lutte contre la pandémie. C'est une question surtout pour le docteur Portugal maintenant. J'ai vu que le télé-based healthcare fonctionne ainsi. Quels sont les effets que vous avez eus sur les malades contaminés au Portugal? Merci.
Sorry, your question was to Mr. Portugal? Okay. And the first one? Sorry, I missed the first one then. Okay.
Oui, pardonnez-moi, j'avais raté la première partie. C'était pour le professeur Salomon.
Thank you very much for your question. It's very important to be sure that all the work in terms of research is clear, transparent, and of course that the experts are independent. And I can assure you that all the decision the government is making in this field is really a decision taken by the expert, taken by the authorities, and not by others or private interests. But it's very important to insist on this point. About the European efforts, it's something very important in this field of vaccine, but also in all fields of research and development, especially for fighting antimicrobial resistance, for example. So what is the good model? It's a very important question for all of us, and I'm not a specialist of economics, but what you said in terms of intellectual property, maybe private and public partnership, or having a European strategy in research, of course, but also in producing some drugs or some treatments or some vaccines or some tools would be something very interesting in building a very strong Europe of health, and especially a very strong way, a very strong mean to be able to fight together in terms of European solidarity. Thank you.
Dr. Portugal? please.
Thank you very much. There are two answers here. It's quite relevant. I would say that what we really need for decision-making on a technical perspective and to advise the politicians on several aspects, for instance, the equilibrium of health and economy, the protection of people and inequities and other issues, is that we need independent and well-done research. All the models are possible. Anyone will be readable if it's an independent. Governments, and in Portugal, of course, we also have strictly rules of conflicts of other experts and other organizations accordingly to making up the norms and decision making. So any model is possible, and there will be a European discussion as well as national discussions all around Europe. Accordingly to the therapeutics, what we have is norms, which means that we advise that the prescription of certain therapeutics must have a window of opportunity that is very much related with the best sciences available. And that's it. So physicians prescribe accordingly. The effect of that is that we have different experiences. Sometimes they prescribe a lot, sometimes they prescribe very low, usually lower than higher. Thank you very much.
Thank you very much. The last one on my...
Merci. Donc, Madame.
La première partie, je l'adresserai à Monsieur le directeur général de la santé, Monsieur Salomon. 2 ans après le début de la crise du Covid, le règlement européen que le Parlement européen a voté le 23 juin 2022 mentionne, dans son article 5, que les États membres peuvent également délivrer des certificats de vaccination aux personnes participant à un essai clinique qui porte sur un vaccin contre la Covid-19 et aussi au motif que le vaccin contre la Covid n'a pas reçu par la suite d'autorisation de mise sur le marché ou encore pour les groupes placebo. D'un côté, on nous vend que le pass permet de contrôler l'épidémie et de l'autre, on voit que ce pass permet à des participants à des études, comme un groupe placebo, d'obtenir le fameux sésame pour se déplacer. Je tiens d'ailleurs à féliciter notre nouvelle Assemblée parlementaire qui a refusé de proroger ce pass sanitaire aux frontières pour les plus de 12 ans jusqu'en 2023. On sait donc que l'autorisation sur le marché est conditionnelle, c'est-à-dire temporaire, car les essais cliniques sur les volontaires sains en phase 3, c'est-à-dire juste après les essais sur les animaux, ne sont pas encore terminés. Le site de l'ANSM indique très clairement que les vaccins Pfizer et Moderna sont encore des produits à l'étude jusqu'en 2023. Ces vaccins achetés par milliards n'ont donc pas empêché la transmission du virus, ni sa contagiosité. Et on le sait tous, vous avez obligé les gens et les citoyens à se faire revacciner tous les 4 mois, voire jusqu'à 4 fois. Dans ces conditions, avec le bilan de ces 2 ans et avant la mise en œuvre de la feuille de route de Bruxelles par Paris, qui impose un plan vaccinal avec le rappel de doses et la vaccination des enfants pour cet automne, voici ma question. Dans le cadre de la MMM conditionnelle des vaccins Covid, quelles sont les obligations particulières exigées par le gouvernement français en matière de collecte des effets indésirables et comment le gouvernement français traite-t-il les données des effets indésirables enregistrés lors des essais cliniques sur des volontaires sains? Je vous remercie.
Professor Solomon, please.
Thank you. A lot of things have been said, so I don't want to comment any political recent actuality, but many points. On the importance of clinical trials, we have to be aware that they are absolutely needed if we want to give to our population vaccines that have been tested. And so we have to reinforce and we have to strengthen the surveillance of all these clinical trials. And of course we could wait for months or years and say to our European populations that they won't have any vaccine. But really now everything has been published in different publications in Europe or in the US or even elsewhere. The impact of vaccination against COVID has been huge on the risk of death, on the risk of severe cases, on the risk of hospitalization, and it's not anymore debated. the vaccination is not mandatory in the French population, as you know that, and all the safety of the vaccination is controlled by the ANSM in France and, of course, EMA in Europe. Everything is transparent. Everything is on the website. All the French citizens can notice and can signal an adverse event, especially a severe adverse event, on a public website, on notification site. So all the severe adverse events are on the official website of the ANSM, and it's really a very strong regulation to analyze with independent experts the benefits and the risk of all the vaccines in France and in Europe. Thank you.
30 secondes. Oui, merci. La seconde question s'adresse au docteur Portugal. Donc, vous êtes le modèle, vous êtes le meilleur élève européen, puisque nous le savons tous, vous êtes champion d'Europe en matière de taux de vaccination. En janvier 2022, c'était près de 98%. Et aujourd'hui aussi, vous êtes le champion d'Europe en matière de contamination Covid. Donc la question, c'est comment vous expliquez ces résultats, notamment après la 4e dose. Et j'irai plus loin. Est-ce qu'à un moment, on compte s'interroger sur l'efficacité de ces vaccins, ou est-ce trop tabou? Et aussi non, s'interroger sur peut-être un problème d'effet négatif sur le système immunitaire des vaccinés. Je vous remercie.
Dr. Portugal.
Thank you very much. A very relevant question, and of course, the first thing we always need to say is being humble, and we know that we don't know all the story at this moment. We need to have some time to better understand what are the phenomena going on here. But I can tell you, from the vaccination point of view, that, for instance, for the last 2 months, death mortality for the people with the second booster, with 80 and more years of age, nobody died. And comparing to a percentage of lethality of 9.5% of people not vaccinated with the same age during this period. Or, for instance, the people with the same age that got just the first booster, not the second one, they had a lethality of 1.7%, and compared with is nil for the second booster, or 9.5% of lethality with no vaccine. There is an effect here without any doubt. However, it does mean that if you have a very high level of, a very high incidence of the disease, of the transmission of the disease within the group, it means that even the lethality is a very low one, but the numbers are very high, you have mortality. Which, you are right, it looks, and everybody said that till now, which means that we still need, and we hope we're going to have by the end of this year, a new vaccine that will also have a good effectiveness for the new variants, which we didn't have it by now. So the difference might be that the new vaccine that we're going to get by the end of the year will be accomplished in good effectiveness for the Omicron, and we hope that we'll have much better results, as we wish, all of us. Thank you.
Thank you very much for that answer. And the last question.
Merci beaucoup. Madame de Lapisse. Moi, j'ai 2 questions à vous poser. Tout d'abord, pour Monsieur Salomon. Ce qui m'interpelle le plus, c'est le manque d'informations sur le fonctionnement de l'immunité naturelle. Au début, on pouvait comprendre, mais quand même, au bout de 2 ans, non, on ne comprend plus. On ne comprend pas que cela n'ait pas été analysé du point de vue statistique, mais pas non plus au niveau physiologique, anticorps dans le sang, endocrine, la biochimique. la coagulation, quelle est la part de l'immunité innée de l'immunité adaptative, quel est le pourcentage de malades qui ont eu des symptômes sévères, quel est le délai entre les réinfections, quelles sont les caractéristiques des personnes, est-ce qu'il y a un phénotype particulier, est-ce que l'on peut savoir quels sont les facteurs de prédisposition, sauf bien évidemment les comorbidités et l'âge. Bon, voilà, comme vous voyez, il y a des millions de questions qui sont encore sans réponse. Donc, pourquoi on n'utilise pas les tests sérologiques pour prouver le statut immunologique, pour être rassuré et pour savoir aussi si l'immunité artificielle est pertinente ou pas. Voilà, c'est une information cruciale pour prendre des décisions aussi bien au niveau individuel qu'au niveau de la société. Et pourtant, on continue à prendre des décisions tout à fait arbitraires, avec sans preuve. Et c'est là l'origine de la méfiance des populations vis-à-vis des institutions. On continue avec beaucoup de questions et des questions qui restent sans réponse. Alors je sais que j'ai posé beaucoup de questions, mais une seule, si je dois choisir, pourquoi on n'utilise pas les tests sérologiques comme preuve de l'état immunologique individuel et collectif pour connaître notre degré de protection et savoir à quel point on peut être rassuré et en risque d'avoir une infection grave.
So first, Professor Solomon, please.
Thank you. It's a huge question, and I could say, as my colleague in Portugal said, that we have to be humble, of course, because as usual in medicine and as usual in science, we have to deal with millions of questions. But we have to be honest and to say that in terms of immunity, natural immunity, or as you say, artificial immunity, which is something quite strange, we know a lot and we published a lot. And when I say we, it's not the government, it's different experts, different researchers in the world. Especially in the field of immunity, I think there is more than 1,000 published papers. So really there is a huge effort of research, and we can say thank you to all of the teams within the world. There are still questions about the immunity of individuals, the genetics impacts of individuals. We have animal models, we have human people who are participating to research to study their antibodies level, their cytokines in the blood, and everything. So what you said about the level of antibodies, it's something very important to know. The level of antibodies is something very difficult to interpret in terms of the level of protection. Why? Because you have this antibodies level, but also a very important immunity which nobody talks about, which is very important, which is the cell immunity. And the level of antibodies is decreasing in all humans after the infection, after the vaccination, because these antibodies are not used. So that's why we can't use the serological test, because if you have met the virus, if you had the infection, or if you had the vaccination, everyone has this serological test. The level of antibodies is very different in different humans, and we are not able, that's very important to say, we are not able to interpret this level to say, well, there is no risk, madam or mister, because your level is very high. So if you have a very high level, it's something quite reassuring, but we have to study very more your immunity, your cell immunity, all what you said about cytokines and everything. And it's very difficult to say now that an individual is protected and strongly protected. But what we know in terms of population is the impact of the vaccination in decreasing after 1, 2, 3 doses, and especially now against Omicron. It's really very significantly in huge populations, decreasing the risk of death, the risk of severe cases. And as you say, there is no proof. Of course, there are a lot of information that are asked by all the European authorities, and you could ask the EMA about the huge amount of documents, papers, and studies that are necessary to obtain an authorization in Europe. Thank you.
And finally,
ma question pour le docteur Portugal. Savez-vous, monsieur, pourquoi on n'a pas investi dans des essais cliniques avec des principes actifs qui ont été approuvés pour d'autres indications qui auraient pu aider à la maîtrise de cette maladie? Souvent, c'était des molécules qui n'avaient pas de brevet actif et qui permettaient aussi d'être administrées par voie orale. En mars et avril 2020, certains essais ont été lancés, mais toujours sur des patients qui étaient déjà très malades. Donc l'efficacité n'a pas pu être démontrée. Au lieu de réagir, enfin de faire l'essai clinique sur des malades qui avaient une charge virale assez faible et maîtrisable. Pourquoi est-ce que cela n'a pas été fait? Je pense que cela aurait été sans doute la meilleure des solutions, agir dès le début de la maladie avec une faible charge virale, avec un traitement qui pourrait être administré par voie orale et sans besoin d'hospitalisation.
Okay, for the last answer.
Merci beaucoup, Monsieur Portugal.
Muchas gracias. Let me tell you that unfortunately we don't have so strong research equipment and for doing this kind of research in Portugal. However, I can tell you that there were several groups in all Europe and all around the world that they did a lot in a very short period of time. So we can look at these positive aspects. We never had a vaccine in such a so short period of time that we know at this point that protects people. Of course, there are several ways of tackling this disease. We can prevent that with, for instance, the known pharmacological interventions or vaccines or other issues, or we can have drugs to treat on different aspects with trying to treat that on the perspective of not having a more severe disease, or it will be the ideal situation to treat that people wouldn't transmit the disease. We know that it is very difficult at this point that the transmission of the disease is being cut, the transmission chain, it's very difficult at this point to be tackled, to be stopped with even vaccines or and more with drugs. So it very much depends on the strategies and where to put the money. What you have said is just one of the possible strategies. It wasn't the one that was approved by the governments and those who finance the research. That's all I have to say about that. Thank you.
Thank you very much. And that
Merci beaucoup. Et cela conclut cette audition avec ce panel. Je voudrais remercier au nom de l'ensemble de la commission nos trois invités. Je pense que c'était vraiment intéressant. Merci aussi beaucoup pour l'ouverture d'esprit dont vous avez fait part dans votre réponse. Alors, nous espérons, dit la présidente, qu'on pourra résoudre le problème. Si l'administration du Parlement négocie avec les interprètes, on pourra sans doute le résoudre rapidement. Merci beaucoup. Ça, c'est la note de l'interprète. Donc, c'était véritablement long. Nous avons les coordinateurs à 17 h. En tout cas, on se retrouvera lors de notre prochaine réunion le 30 août. Et si je ne vous vois pas, d'ici là, faites le plein d'énergie pendant l'été parce que l'automne sera vraiment intéressant à cette commission.